When it comes to living and thriving with AML, Dr. Mims, managing disease symptoms and treatment side effects is a big part of that. Would you talk about how symptoms and side effects can impact life with AML?
Sure. So I think from my perspective, what we are always trying to do when we're moving forward with a treatment plan is, of course, get patients into remission. But the purpose of getting into remission is not just to achieve that, but for patients to have quality of life. And so there needs to be continued dialogue between the patient and the treatment team about how you're feeling during treatment, because they're definitely based off of therapy, different side effects, things that could be, not necessarily due to active leukemia anymore. And so there may need to be dose adjustments and other things that we do to the regimens in order to make you feel as good as possible while continuing on treatment.
Mhm. Why is it so important for patients to speak up about any issues they may be having?
I think it's important because you're your own best advocate. Being the patient, being the person who's living with having this diagnosis and going through the treatment, myself or other colleagues as physicians, we can have a sense of what may be going on based off of numbers, but we're not truly going to know how you're feeling unless you speak up and let us know. And there may be things we could do, with supportive medications, dosing adjustments, as mentioned, that could help in, making you hopefully feel better and less side effects and toxicities from
Mm.
treatment.
What are some common symptoms and side effects that you hear about?
So sure. So different side effects that I would say that people can have. People can feel fatigued, just from treatment in general. Some of our therapies can cause neuropathy, skin rashes, nausea, vomiting, diarrhea. And so all of those are important, along as mentioned with, symptoms you may have from decreased blood counts, that, we do have interventions that we could implement to help, the make the therapy more tolerable.
So, for these side effects, like fatigue, for example, what do you do about that?
So I think it depends on the level of fatigue. Of course, I wish we had a pill that could just make fatigue improve, but if it's really that the treatment is deriving it and it's impacting your quality of life, there are dose reductions or things we can do that may help with the level of fatigue you're experiencing.
And what about some of the other side effects? You mentioned diarrhea. Uh,
Sure.
what, what, how is that handled?
Yep. So for issues from like GI complications such as nausea, vomiting, diarrhea, we have really lots of choices for anti-nausea medicines and different combinations we can use. There are newer antiemetics that can help with that. And from a diarrhea perspective, it depends on the treatment, but of course we want to make sure first and foremost there's no infection, and if not, then they're good antidiarrheals we could add onto the regimen to help with that as well.